Our session objective for today is to explore, identify, and discuss findings and activities to address clinician and physician retention and well-being. The title is Fighting Burnout, and we are joined this evening by our wonderful guest speaker, Dr. Christina Bowen. Dr. Christina Bowen has been practicing medicine as a family medicine physician for over 15 years, which is amazing because she's only 25. She began her leadership experience as a chief resident at Carolina's Medical Center in Charlotte, but she later returned to Eastern North Carolina to help serve the rural communities where she grew up. She also serves her community as a chief medical director for the past 10 years for the Dare County Department of Public Health, where she's engaged in public health initiatives in a rural community. And for all of you who know me, you know my background is in public health, so I always want to applaud and cheer for those people who are working in our public health departments. The National Organization of State Offices of Rural Health recognized Dr. Christina Bowen as the first North Carolina recipient of the Community Star Award in 2020 for her great work in the field of public health. In 2022, Dr. Bowen accepted the position of ECU Health's first Chief Well-Being Officer, and we're so proud of her in that capacity. In that role, she champions well-being efforts through the lens of team member and provider engagement and equity. She also leads ECU Health's wellness teams to introduce and support new programs that positively influence the population health of the communities of Eastern North Carolina. And I know Dr. Bowen because she serves as the past president of the North Carolina Clinician and Physician Retention and Wellbeing Consortium. And so I'm pleased to be able to work with her in that regard. She is a member of the North Carolina Medical Society and one of those people that we always turn to when the topic of well-being and wellness come up. So I'm going to go ahead and skip ahead. There's your evaluation link. Please feel free to scan that with your phone now. We will also send you the link via email so that you can click on it and do it via your computer, and we'll put it in the chat as well. And I'll show you that same evaluation link again at the end of our presentation. And so without further ado, I'm going to go ahead and stop sharing. I'm going to ask Dr. Bowen to jump in and share her screen.
Oh, great.
And
That's what I was
I
going
will
to
turn it
ask.
over to Dr. Bowen. And I see as she gets ready to share her screen, we've been joined by Dr. Komaves, our clinical co-chair.
Yeah, hi, Manisha and everybody. Glad you were able to join us and really looking forward to hearing from you, Christina. Thanks.
Thank you. All right. Can everybody see my slides okay?
Yes, ma'am.
Okay, great. Well, thank you so much for letting me spend this hour with you all. I saw shout outs on the chat for CMC, so I'm very curious. Did someone train at Carolina's Medical Center?
Hey, sorry, that's me. I'm Chirag Patel. I'm one of the PGY6 Hemonc Fellows at Atrium. I did IM residency at Atrium as well. And I
Awesome.
was actually a medical student at ECU. So it's just when I was hearing about your bio, I was like, wow, this is awesome. She's the real deal coming back to Eastern NC.
Yeah, that's so cool. Well, yes, I graduated from Brody in 2003. I feel like a dinosaur now when I say that to the medical students and the
That's funny.
residents.
Yeah, no, I was just actually talking to one of my preceptors at the VA. He actually graduated from ECU as well in 2005. If you know Michael
Oh,
Goodman.
I do know that name.
Yep.
Yes,
Yeah.
that's amazing. Well, it is wonderful to get to be with you all. I just love getting to hang out with other North Carolina providers anytime I can. And so before we get started talking about well-being, one of the things I'm going to go through a couple of slides so you know, Monisha said, Christy, she's already gone over the learning objectives with you. I also will disclose nobody's paying me any money to say anything or use their products. I have no disclosures. So I have nothing to disclose. And other than this is a topic near and dear to my heart because I love the state of North Carolina. I love the communities that I get to serve in Eastern North Carolina. And I feel like the practice of medicine is a sacred gift that we get to do every day. And so taking care of our providers is really, really important to me. Um, So well, we can just have the slide up there, but I really wanted to start today because Monisha was wonderful and she shared with me everybody's name and where they're from and where they're practicing, which was amazing. But it doesn't necessarily tell me why you went into medicine or who you really are. And honestly, when the rubber hits the road, we know from the standpoint of burnout and provider well-being that connection to purpose is one of the things that gets us through really, really difficult days. And so I wanted to start today's session with asking everybody, if you would, you don't have to come off camera because I know some people might not be in a place they can come off camera, but tell us your why. Why did you go into medicine? I can start. How about that? I'll start. Um, I feel really cliche when I say I like to help people, but that was my 23-year-old answer when I went to Brody School of Medicine. And now I can tell you in my role that I'm serving, it's chief well-being officer and when I thought about being the medical director for the Dare County Health Department, I love Eastern North Carolina. And I love taking care of people. And I'm really a geek for math and science. And so when I got to combine those and be like, I could really come alongside people and have this level of trust and maybe help them be a little healthier so they can live their best life, I was like, I'm in, sign me up. And so to me now, that's what I think about when I think about the practice of medicine. I'm an integrative and lifestyle medicine provider, and I do still practice clinically. And so that's my why. And as my kids tell me all the time, I'll sometimes say, I could have been a stay-at-home mommy, and because they see me working all the time, and they're like, Mom, you would not be good at that, and you love what you do, right? And so I'm glad that I've been able and been blessed to be in a profession that I truly feel that deeply that I love, and the people around me can see that I love it. So tell me your why.
I can share my why. Christina, thank you for being here with us today. I'm Janelle White, and my why is I have an older brother. He's 7 years older than me. And when I was in middle school, early middle school, he was involved in a hit and run. He was hit by a car. I grew up in Miami, Florida. So he was at the Ryder Trauma Center, which is the
Yeah.
level one trauma center in that city, and
Mhm.
just seeing the doctors, how they pretty much saved his life. To me,
Yeah.
mind was blown, right, and couldn't believe it. So, I thought just the coolest profession ever. So that is my why.
That's an incredible story. And is your brother, he's doing okay?
Yes, thankfully.
That's great. That's great. Who else? Let's all go. Let's all tell our
I could.
why.
Oh, sorry, Tro, you go.
No, well, mine's fairly easy because I think I'm one of the only administrators in here, but I've had a very long, extensive years of experience in the medical field.
Yeah. Yeah.
What brought me in is as a very junior Army officer, second lieutenant, I wanted to fly medevac helicopters. So I chose Medical Service Corps to fly helicopters. And then throughout a very long military career, wound up tracking more in healthcare administration and finance, and so that kept me in the medical field, at least on the administrative side.
That's incredible. You help us so much. We're all on a team together taking care of
That's
patients.
right. That's right.
Yep.
I can go. My name is Nicole Stanzion. My why on medicine is really like I agree with Janelle. It is just the coolest profession ever. It is so stimulating mentally. It's always changing, and I think I've always just been a people person and can kind of relate and really love the idea of really helping people take care of themselves.
Mm, love it. Who else?
I think my why is kind of similar to Janelle. I had a personal experience when my grandmother, when I was in college, she was going through diffuse large B-cell lymphoma, and the treatment for that was hard on her. But it was nice to see the doctor not only treat her, but keep our family kind of at peace with what was going on.
Mm,
Luckily, she got through the treatment well, and she's actually disease-free now. Still alive, and it just as she
that's
gets
awesome.
older, she tells me that it's just harder to be as active as she used to be, but. I think that was a big calling for me, being able to really appease not only the patients but their family members and trying to build a bridge of connection between everyone in the room. And then as I went through medical school, I did the Leaders in Innovative Care Scholars Program at ECU. And that taught me a lot about health systems and how important it is to understand these things as practicing physicians. So I think my motivation has changed a lot in the past couple of years. Of course, I care about the people and the patients we serve, but I also care about the providers and how much value they add to the system. I think it's important to recognize that value and bring that to the table, no matter what kind of role you serve in medicine.
Yeah, that's great. Did we get everybody?
I'll go.
Okay.
Claire Paris. I always thought it was interesting, sort of thought about it, never really acted upon it. And then I was a political science major in college and ended up having sort of a big knee reconstruction, and it impacted me quite a bit. And I went through, to a couple physicians that I didn't have confidence in, and finally found one that I did, and he did the right things. And I just became really interested then. And so here I am. So I
That's
just sort of
amazing.
changed paths and went to med school. So
That's incredible.
And I see two more, Ronnie.
So hey, I'm Ronnie Laney, family physician. I guess I'm kind of the same as it's a marriage. I saw medicine as a marriage between science, which I got, and people, which I wanted to understand. And so medicine just married those two together for me. And so that's why I chose to go into medicine. I love science and I love people.
That's great. I've never heard it said like that. That's so great.
And Tim, would you like to share yours?
I'd be happy to. Let me open my lens. That's the problem. Hey, everybody. I'm
Hey.
Tim McGrath. Christina, I'm a lot like you. It may sound common, but the ability to help people, and I am blessed to know that this is what I came here to do, and I truly appreciate the opportunity to do it. And I think I've always known I wanted to be a physician. And when I look back, my mom was a nurse, and I can recall she had suffered from bipolar disorder, and I can recall my two aunts explaining to me that my mom's brain was sick when she was in a manic episode. And at 5 years old, I decided that was it. I was going to become a neurosurgeon because neurosurgeons fix brains. Fortunately, I got away from that and thought I was going to be a surgeon for a while. Did my family medicine residency and loved it. Just the ability to know people in that manner, and what happens behind the door is just spiritual to me.
I agree. Yeah, that's incredible. Thank you.
And I'll jump in. I think I'm the last one. So like several of you, I had experience as a patient with the healthcare system, and not terribly positive. And except for one doctor, I had a retroperitoneal hemorrhage and was flat on my back and couldn't walk for like 3 months. But I did have one really good doctor who communicated really, really well. And that's when the switch flipped. I'd been heading for a PhD kind of thing and decided to go to medical school. But I think my career has been very diverse, and the best part about it is being able to be a patient advocate when I'm doing patient care and a provider advocate when I am in my administrative role. Often get to serve as the voice of the provider in the room, which I know, Troy, you probably do this too, right? But it's the providers, the physicians that take care of our members from a health plan perspective. And so it's really important, to me at least, that we respect that role and understand the challenges of being a doctor in today's environment and try not to make it any worse for you than it already is. So anyway.
That's great. Well, thank you so much. I think it really sets the tone and the stage for us to get to talk about well-being and take a holistic approach. And so please do not let this be death by PowerPoint. This is a small group. Please just like chime in, come off mute, and let's have a discussion. I really like starting with this, and that's the quintuple aim. something that makes me really, really proud is Christine Sinsky was who helped us know, yes, the triple aim, we knew that we needed to have quality experience in finance. And then we came alongside and said, you know what? Can't remember if it was 2013 or 14 that she wrote the paper in the Annals of Family Medicine that, hey, you know what? We should probably think about provider well being. So we should probably have this concept of quadruple aim when we think about taking care of patients because we had been at the table to care for the patients, but our well being and thinking about our health and the healthcare workers' well being hadn't really been there. And then now that, the other element that we're hearing over and over again when we think about, provider and team member well-being is this concept of a quintuple aim, and I like to think about it as the concept of belonging. And so we know that for people to really feel like they're engaged, they really have to feel a sense of inclusion and belonging with their team, with their health system, and so really having both team member well-being and that concept of inclusion and belonging alongside quality and experience and finance of our patients with patient care. So I'm going to try to be a good driver of these slides, but they're not really cooperating. Here we go. I got it right here. So this is something, have any of you seen this concept of the virtuous cycle before? I'm seeing Tim's head shake. He's my only one I got on that I can see.
No.
So anybody chime in? Has anybody else seen this?
I have not.
I have
Okay.
not.
So I really like this when you think about gears on this is just basically showing that it starts with inclusion and belonging and then taking care of our healthcare workforce. That really helps them to be engaged. And then that really starts this safe care of patients, quality of care experience, efficiency. I really like to think of it more as gears on a clock, right? We really have to have all of these gears for our healthcare system to work well, right? So we really need strategic focus. And I really believe that this is, from an organizational level, even down to like, I think about my clinic that I work in, like my little microcosm. We need to have this concept of inclusion and belonging and well-being and engagement of our team. How's that going? It's going to help us really drive better patient care when it comes to quality and safety. And then we're able to think about how are we? I love what you said, Eugenia. I'm not sure if I'm pronouncing your name correctly, but you said, are we taking care of some of those burdens that really are hindering our healthcare workers and really not leading to efficiency of practice? And then what comes out of those gears is usually a well-working watch, if we're talking about a watch, or really great patient experience, because all of these things are really important for our patient experience and for our team member experience. And so I really like this concept because I think well-being can often get siloed off over here as a nice to have, not a have to have. In a healthcare system, in a clinic, and it really is part of this virtuous cycle when we think about taking excellent care of patients. And I think it seems to resonate more with administrators, with physicians, with my APP colleagues when we talk about you all, these are gears on a clock. We need all of these pieces so that the clock works well. And that really is true. And that's what we hear. I know that we hear that at ECU Health all the time. Thank you for having a strategic focus on me and my well-being. Thank you for asking about whether I'm engaged. And then that really does help us as we lead other initiatives, especially we'll look at the next slide. We think about all these dimensions of well-being, right? So when we think about that virtuous cycle, when we think about the importance of well-being with excellent clinical outcomes as our ultimate goal, these are the dimensions we think about when we think about well-being for our healthcare workforce. So that's for physicians, APPs, our administrators, for our administrator that's on the call. This is for everybody that's working to take care of patients and is part of our healthcare team. This is how we at ECU Health define the dimensions of well-being and really how we organize that, right? So emotional well-being, environmental well-being, it's creating a pleasant and healthy work environment. And a lot of times we hear oh, okay, do we have scenes of nature? And it's like the physical environment. This is also psychological safety. So, what does that look like when you think about well-being? Because we know it's really hard for people to report safety events if they don't feel psychologically safe. If they don't feel like they're included in the conversation, it's very difficult for them to report those safety events, workplace safety or safety of patients. So, environmental well-being is really important. Financial well-being, that's something that we heard during the pandemic. So I like to say I started doing this role in 2020 and I officially got the title in 2022. But one of the things we heard was around financial well-being. And then intellectual well-being, interestingly enough, we heard a lot. This isn't just about my professional growth. I want things outside of that. So we've started book clubs and, things that really aren't healthcare related. They said, I want to have those opportunities here at work, though. Physical well being and then social well being. One of the things, because I am a dinosaur and graduated from medical school in 2003, I remember when we went to the radiology room and we would read the x rays with the radiologist, right? And we'd all be a team and you'd sit around with the radiologist and you'd have conversations, and that really doesn't exist anymore. So, this isolation for people in healthcare is real. And we've seen it, it's just growing, it's continuing to grow. So, that concept of social, that's one of the number one things we hear from our physicians and APPs at ECU Health is whenever we have, if it's a summit or an educational opportunity, they're like, it was just so nice to get together with other physicians and APPs. Like, it was so nice to have that sense of community. We don't really have that as much anymore in medicine. And then that sense of spiritual, and that's really to me what brings you great joy, right? And so creating those things and thinking about that concept of joy. I love the AMAs, joy in medicine, right? I mean, we really can have joy at work, even though, as we've said on here, it is hard to practice medicine at times. There's so much joy. And then this is unique to ECU Health. We actually designed this well-being wheel. And at the center, we put hope and purpose, because one of the things we heard coming out of the pandemic is some people felt that they lost a sense of hope. And when we lose a sense of hope, it causes us to feel less engaged, and it really doesn't support our well-being. And so that's why, and purpose, that's why I started our talk today with what's your why? Because we know that directly connects to your sense of well being, decreasing burnout. And so, really, really important as we think about that. So, how many of you have seen Stanford's model for professional fulfillment? No. Tim says no.
Nope.
Janelle? No.
No.
Roy, no. Oh, well,
No.
I feel so excited to share this with you all. If this is the one thing I share with you, take this model, because I really actually think it's genius. And it really is taking well-being into the next era. So when we used to think about healthcare worker well-being, we would say, you know what? You need to take more time off. You probably need to do yoga. Are you meditating? Are you having self-care? Blah, blah. That wasn't wrong, right? But it's so much bigger than that. And that's what this model really highlights. And this resonates so much when I share this with, it's funny because I think originally they probably thought about this for physicians, but I share this broadly at ECU Health. And this resonates so much with our nurses, with our physicians, with our administrators. They're like, oh my gosh, this is great. Because there's three parts to thinking about your professional fulfillment, your professional well-being. There is the concept of personal resilience. We actually don't use the word resilience, to be clear, at ECU Health, but this is Stanford's model and I can't change it. We have heard at ECU Health they don't like this word, but that's concept of personal well-being. Yes. Are you taking care of yourself? Are you finding meaning at work? Do you have life work harmony? Do you have social support, right? Are you maybe doing yoga? Are you doing meditation, right? What are you doing to have those positive stress coping? But then there's this concept of the culture of well-being. That's organizational responsibility. There's some personal responsibility, like how am I showing up as my best self? Am I contributing to the culture in a positive way? But that's a lot of system and organizational responsibility, leadership, appreciation, peer support, coaching programs. Those are some to name a few. And then this efficiency of practice. How many of you have heard of the GROSS initiative, getting rid of stupid stuff? Yes, you have heard of that. Yeah. I figured,
Yes.
Janelle, you've heard of that. Okay. Um, it's eliminating the administrative burdens, right? And so I showed this model to my husband the first time I saw it, and he's an orthopedic surgeon, and he's like, that one right there, that efficiency of practice. When my ORs turn over efficiently and I can get my cases in and out, that definitely supports my well-being and my professional fulfillment. And that's what we hear from a lot of our providers. And it's not just from providers. I'm looking at you, Troy. I would say our administrators would say when things work efficiently and effectively, it supports my well-being and I'm able to do a better job. And so I really appreciate Stanford's model because it really highlights both the personal responsibility but also the organizational responsibility towards well-being. So I wonder, do you have any thoughts about that? What are y'all's thoughts when you see this model for the first time?
This is Ronnie speaking up. I will say that this is what I've always chimed in. I'm so tired of hearing about, oh, do this, do more yoga, do put the onus on the provider to fix
Yeah.
your own burnout. Get
Yeah.
the bull crap out of my way. I'm sorry. I signed up to that part of this model. Get the bull
Yeah.
crap out of my way and reduce
Right.
my burdens. Don't make me do more stuff to make myself happy. Sorry, that's
Ronnie, I love it. And that is exactly, and Janelle, I love your baby that we see poking their head right in the screen. That makes me so happy. That's supporting your well-being. Um, I love it, Ronnie, because that's
make myself happy every day. Get the crap out
right.
of my way.
And and that is what we heard. That's why this resonates so much with me and for our health system is I have a lot of providers and administrators. I'm not leaving you out, Troy. I'm going to keep saying that. That are like, I actually do a great job of taking care of myself. Like I feel like I'm eating well, I'm sleeping, I'm exercising. I just really need you to help me work more efficiently. This is really like a burr in my saddle, a pebble in my shoe, and I need you to remove it. Yeah. Or I can help you, like, let me help you remove it, but like, we need to solve this problem. So I appreciate you saying that. And that's exactly why this resonated with me. I'm going to talk a little bit about personal because I just want us to highlight the importance of personal well-being when you are because you all are leaders. This is a leadership course. So I'm assuming that other physicians, APPs, and healthcare workers are looking to you, whether you have a title or not, you are leading by influence. So people are going to come to you and they're going to say, I'm struggling. And you're now going to have this model because you're going to get these slides afterwards. Also, you want to make sure you ask them if they are taking care of themselves because I can tell you, I'm a coach, and for physicians and APPs, I've coached a lot of physicians and APPs that aren't doing this well. So I just ask them, I'm like, it's not all about what you're doing for yourself, but let me just go through a few things. It's the primary care doctor and me too. Are you sleeping? No, my sleep sucks. I'm not sleeping. No. I'm like, do you drink water? No. We don't have time to drink water. Well, what are you eating? Well, you know what? I just picked up my kids' Rice Krispie treats, or I ate my kids' Uncrustables today, and
Or
I'm
the
like, oh,
Halloween candy in February that's
Halloween
been there
candy.
since October. You're like, oh, Halloween candy. I know it's
Right.
March, but that's okay.
I'm not judging. Yeah. We still have some in our house too. And so that's what I mean. So I think it's a both and, right? So we got to make sure we're doing those things well. So I wanted to talk a little bit to you all about this because you are leaders, because first you have to lead yourself, then you lead the team, then you lead the culture. And so why does that matter? This is one of my favorite slides in the entire world, but my dad sent this to me a long time ago. You can see it's 2012. And this doctor, what seems to be the problem, Miss Johnson? And she says, I feel the way you look, right? We do not We don't want to be that provider. We don't want to be that administrator, right? And so it is important when we think about, to your point, Ronnie, we got to calm on our A game when we're talking to people about the barriers that we're experiencing to have efficiency of practice, right? We can have the same conversation, right? We can have a same topic rather about a barrier, and it could look a lot different depending on which version of ourselves we bring to work. And so it is important when you think about this, like, why does it matter? As goes the leader, so goes the team, and so goes the culture. I don't know if you all have experienced this, but I've had good leaders and I've had bad leaders, and I've watched the ripple effect of both. And it is really true that the leader is who defines the team culture. They really do. And so it's important to think about, how am I showing up? For those providers on the team, you are a leader. Like, the day we onboard, you're going to see some of the things we're doing organizationally. The day we have our new providers, I say, you're a leader at ECU Health. Whether you have a title or not, you are a clinical leader. You're leading your patients and you're leading your teams that are helping care for those patients. And so you're helping to define that culture. So it's important, how how cognitively fit do we need to be, right? And I love this concept of, we're the most important, the healthcare workers are the most important instrument in the practice of medicine, right? Because we're helping to deliver the care to our patients. And so how good do we need to be? How alert, cognitively fit, precise, creative, persistent do we need to be? I would say we need to be on our A game, right? I mean, how many of you feel like you give um your A game? So I like to say we have an A game and a D game. Probably all of you could take a second and think about, what are you like on your A game? What are you like on your D game, right? I would venture to say most of us, our work probably gets our A game more than any area of our life, right? Most of the time work gets our A game. And so if we only have a small bit in that bucket, we want to make sure that we're taking care of ourselves, because we want to bring our A game to work when we're taking care of our patients and we're leading the health system, and bring your A game to those people I just saw pop on Janelle's screen, right? You want to bring your A game, or the things that you said, Ronnie, that bring you great joy, that you're like, I'm happy, I'm doing it outside of work, right? I'm living my best life. But part of taking care of yourself really, really well is so you can bring your A game to work. It's also so you can bring your A game home. I really think about that, because I mean, I'm going to be 95% of the time, I'm going to be my best version of myself at work, but I might not always be my best version of myself at home. And so I really, really believe that's deeply important when we think about our healthcare workers. And we know, I did the Chief Wellbeing Officer course at Stanford, so that is where I got that model. But it's incredible, the research that they've done, that Tate Shanafelt's really leading around what it looks like when healthcare workers are caring for themselves. There's higher patient satisfaction or patient experience. They're more likely to spend time talking about preventative health practices. I think that's so interesting, that if we're taking care of ourselves and we're utilizing preventative health in our own personal well-being, we're more likely to share that with patients. And we know that's so important. There's lower medical error rate and there's better patient outcomes. So really, the science is clear on why we need to take care of ourselves. How would you all feel like you're doing? Like, this is an amazing wheel that we use with a company called One Team Leadership out of Charlotte. And we do a really amazing 3-day leadership retreat for our healthcare, our physicians, APPs, and administrators. And we really lean into, like, how are you doing? Are you surviving or are you thriving? And what do you need to be thriving in all of these areas? And what would that look like? And how would you show up at work? And then how would you be at home? So where do you all feel like you are on this wheel when you're looking at this? Like, all these areas: fun and recreation, family and friends, professional, health and energy, finances, personal growth, spiritual, significant other. What would you rate yourself overall? If you had to look at that.
When you say overall, is that like an
What's the
average of
question?
each of those different areas?
Yeah. What do you think? What do you think your average would be? Usually in a group setting, I would get you to rate all of these. So I really
Mhm.
encourage you. This is something I do every 6 months. It is a great activity. And if you really want to go next level, do it with your partner or your spouse. It's fascinating to really see where you are. But like on average, where do you think you are overall?
Me personally, probably 6 or 7.
Yeah.
I was thinking about this from just like a trainee perspective initially. So like obviously finances are probably in the gutter, so close to like a 2 or 3. But I think the one thing that I was thinking a lot about is how much this wheel can kind of change based upon the month to month for me. So like for example, I'm on a busier inpatient service this month, so sometimes my time is stretched. So maybe a lot of my time goes towards like I guess professional. Like maybe right now it'd be like a 7 or 8 because I'm really that busy. But then my family and friends that can go down to like a 5 or a 4. So I think it's like a dynamic wheel, but I think it's important to kind of think about this wheel from time to time and make sure that the numbers aren't consistently low.
Yeah, and I love that so much. That's what I tell people, if you can keep this wheel front and center. I mean, in my role, I keep this wheel all the time. I use it all the time. It really is a reminder, like, where am I? Because to your point, different seasons. I mean, you're going to have different ratings as you have seasons and in your training, obviously. But you're right, because it is easy to let things slip. So, Ronnie, were you going to say something? You're not on mute. I didn't want to
No,
not
sorry.
acknowledge.
No, sorry, I'm typing. Sorry.
Okay.
I
Um,
forget that Dr. Bowen can't see the chat. And so, just to kind of let you know a couple things that are going on in the chat, I had posted that I saw an email response recently that said, taking time to practice what I preach, disconnect and renew.
oh, I
And
love
so the
that.
person's out of the office for a while. Ronnie chimed in and said, how many of us have heard a patient say, I need to take care of mom, dad, etc. And then he tells them, well, you can't take care of them until you take care of you. And my
Yes.
response was, and do we all take that same advice? Do we?
Yeah.
Go ahead, Ronnie, if you wanted to add on.
Yeah, no, thank you for acknowledging that. And I think that's part of the problem. I think that's why we're here in this call right now is to figure out a way that we take care of ourselves first, because
That's
we
right.
chose this profession to take care of others, and we
Yep.
are seen as champions, but we're burning out, and we got to figure out a way to save the champions.
Yes. Yes. You're so right. And it's really, really hard. What I hear often is it's really hard for people that are truly in a helping profession, right? I mean, we didn't all say that was our why, but underneath that was definitely a thread. Like, I want to help people. Like, I want to be there for them in their time of greatest need. Like, I want to come alongside them and help them. And that's hard for people that is their sense of purpose to say, and I have to pause and I have to take care of myself first before I can help somebody else because it is so ingrained in us to care for others that it really takes a lot of intention to stop and pause and take care of ourselves first. And even, and I'll say all the time, burnout people can't solve burnout problems. So it's really hard if we're burned out, to your point, Ronnie, about the administrative burdens and efficiency of practice. If we're not bringing that cognitively fit, alert provider to the table to have conversations, and I can't remember who said the importance of having physicians at the table. Amen. When we are making decisions, if we don't bring that best version of ourselves, we really can't help fix a lot of problems that we know need to be fixed right now in healthcare. And we're going to continue to see people leaving healthcare and burning out. So it's important to think about, and you as leaders, I mean, and it's going to take, I say administrative burdens feels like boiling the ocean. So does well-being sometimes feel like that. But it does take us as leaders, as physician and administrative leaders, to model this. So just like Manisha was saying, like somebody saying that, like, oh, it makes you pause and think about, like, I'm doing this so that I can be the best version of myself and create this culture of well-being where I work, and maybe in my health system or wherever it is that you're currently working. So something else that's super interesting about this, what would you rate as your top two priorities on this wheel? What would y'all rate?
Family and friends and personal growth.
Okay. Give me a few others.
Spiritual. Excuse me. Spiritual. Definitely.
Spiritual. What's
Family.
one more, Tim?
Personal growth.
I'm on track with family and friends. I wish I could spend more time on health and energy at my age because of health issues I've had recently, but it's low and I would like to be able to shift some focus to that versus professional or, work related type stuff.
Yeah. So interestingly, what are your priorities? So even for those of you that didn't speak up, just I want you to take a minute to pause and look at those top two that are really important to you. Like I really need those to be doing well for me to bring like my best version of myself to work, to anybody. I got to be focused on those. Now think about what are the areas that get neglected when you're stressed and you're super busy?
Health and energy.
Troy, you're shaking your head. You said that's a priority,
Yeah,
but it's getting
that
neglected.
was kind of where I was leaning to. I wish I could spend more time on health and energy, but
Hmm.
yeah, it's a challenge.
Yeah. So often what we see, and I've done this with hundreds of people, um, is that people say, these are my top priorities. Like, I gotta have these so that I can bring my A version. And then I'll say, okay, and which ones get neglected when you're stressed? And there's overlap. So that tells you if we're not intentional, and I mean, I don't really minus vacation ever not have a busy day, right? Even if it's a Saturday and I'm home with three kids and my husband, right? It seems like there's always something to, so it takes that level of intention to think about, just like I can't remember who said it, like having this at the front of your mind, like am I being intentional about my top priorities so that I really can bring that best version of myself to work, to home.
So to that point, Christina, so I started a company called Five Prime, and the name is around five primary things that I need to do every day. So
Oh,
medicine, exercise, music, personal things, and my dog or family friends. Those are five things I need to do every day. And I have a chart that I fill out every day that says I'm going to attack those five things every day. I think we
that
can do
is
that because if you put
fabulous.
aside things, you can make excuses. I don't have time. Well, I make it a priority to do those five things every day.
That is so, can you share that with us after this? Because that's incredible. I love that. And I think it requires that level of intention.
Yes, I
And
can. Yes.
and what I heard, Ronnie, is it's not like a crazy big goal. You're just like, these five things I got to do every day, and they're not huge.
So I live and die by my whiteboard in my kitchen. I put in my hard stops every day. My work schedule, those are hard stops. So I'm in two bands, so I practice for those. And my dog, I put the hard stops in, and then I sprinkle in. I mentor students, so I sprinkle in those things wherever I can. I make sure I get those things done. And if
Every
we
day.
do those things every day to ourselves, that's great. Let's get rid of the crap in my way.
It's
So yes, I'll.
I love that. So you have to share that with us. That is so amazing. And God, I was having that conversation with somebody yesterday that like if you lived your life like that, like these are my five priorities I got to do every day. There are some things that are going to fall off your list, but at the end of the day, you're really staying true to who you are. That's incredible. Um, so I just love showing this slide because I think minus Ronnie, who actually does seem like he has it all together with his practice that he's going that he's going to share with all of us. Most people don't have it all together. And it's so funny that, yeah, I mean, I'll coach people and they'll say, well, this person and that person and they seem like I'm like nobody has it all together. We are all on a journey, right? We're all on this life journey. And so let's not focus. I tell my kids all the time, comparison is the thief of your joy. Let us not compare ourselves to anybody else. Let's just keep an eye on how we're doing personally. Um, so we've already gone over the dimensions of well-being. So I just wanted to really quickly highlight this because we could run out of time. Nutrition, nutrition, nutrition. Just making sure we're not, I don't know about you all, but in residency, I would grab like graham crackers in the little peanut butter jars, and that would be what I sustained myself off of for an entire day. Like we got to be mindful about how we're nourishing our food. I'm not going to get into a whole big discussion about what that looks like, but making healthy food choices. And the other thing is hydrating, making sure we're staying hydrated. I can't tell you how many of my nurses I see, and for whatever reason, I'm talking to them about, you really got to hydrate. Maybe they're on a certain medication or, kidney. I can't hydrate, Dr. Bowen. I have to work. I'm like, well, that's a lie you're telling yourself. You actually have to drink water, right? It is important. It's important to your cognition. It was interesting to see one of the papers that one of the dietitians at Stanford had written about dehydration and cognition in providers. And so there's a lot of really cool evidence out there. I don't think I have to tell you all, guess what? When we don't sleep, burnout increases. It's remarkable. If you want to see the world through like dark blue glasses and you're like, don't sleep. I mean, would you all agree? How many of y'all are like me? Like I have to dig deep, deep, deep to show up as a good version of myself when I don't sleep. It's really, really
Completely
important.
agree.
Yeah. And I feel bad because we have a fellow on, and I feel like maybe you don't always get the best sleep. So that makes me sad.
I won't lie. As a PGY 6, it's a lot better. As a
Okay,
PGY
good.
1 through 3, it was terrible. But it gets better as you get a little extra number on the end of your PGY.
Yeah, good. That makes me happy. But sleep
In
is so
addition to sleep, you learn what part of the day you're the most, you're fresh, right? And you're able to be more productive. It used to, for me, be end of the day, and now it has to be first thing in the morning, So I
I
think
know.
that is in addition to sleep, but understanding, when you can have more capacity
I love
to
that.
make
Like your
things.
biorhythms.
Mm-hmm.
Yeah. No, that's a great because it's how are you going to map out your day? When am I most productive? And when am I, maybe I can answer emails because I don't need to have that white space in my day where I'm really thinking and I need to be as creative as possible. And I think that's a really good point to add to this 100%. And I would agree with you. In the morning, I'm much better by 5 o'clock. I hope y'all are getting at least a B plus version of me right now at 6:15 after about 10 meetings today. Um, so emotional well-being, I like to ask people to rate their top three stressors. And we're not going to spend a lot of time on this, but really to think about what are your top three stressors? How are you coping with those stressors? And sometimes it's can you eliminate them? Because it's often that other human beings are your top stressors. Sometimes we can't, say, I don't want to be in a relationship with them, but maybe could you put some distance, right? So having those healthy boundaries in place, and really thinking about what are my stressors, like what really tweaked me today and got my heart rate up, that got me stressed today. And then how did I deal with it? How did I respond, right? Did I pause? Between stimulus and response is the pause, and that's where our power lies. That's Viktor Frankl's quote that I love, who's a Holocaust survivor, right? Did I pause before I responded when I had that stress so that I could cope more effectively?
One thing I've learned from this program, Christina, is curious, not furious. I used to respond
I love that. I'm
quickly.
drinking water.
Now I step back and go, all right, how should I address this problem? So I've learned
Mm,
that, and
that is
it's done
brilliant.
wonders for me.
Yeah, I think that's brilliant. And that is one of my favorite skills from coaching is to be curious rather than judgmental, like to be open and curious. Um, and that really does allow you to be less, what I hear you saying, Ronnie, is reactive. You get to choose your response rather than react, which is great. Um, so decompression is one of the things that we definitely hear from healthcare workers that they struggle with because I mean, I don't know about you all, but I have patients from 20 years ago that I could think about their case and it's like I'm right in that room and I can smell the smells, I can hear the sounds. It's like I'm right there. And so it can be really hard to disconnect from work. And so having some sort of a decompression ritual that you try to do so that you can show up at work, it's so you can show up at home and you're not bringing all of the patients, all of the administrative responsibilities with you to home so you really can relax and recharge. I feel like Ronnie, I heard in your five intentional practices every day that you had some things on there that probably help you decompress. One of the things I heard you say is a hard boundary. Would that be
Yeah.
true? Safe to say?
Yep.
Yeah. And I think you all know this. We're not machines. And our body needs rest. That's often what we think about. Our mind and our spirit need rest, right? Like Tim said, you said spirituality is your number one priority, right? Your spirit needs time to rest and breathe. So we've got to decompress. It supports our emotional well-being. Our brains need to not process all day, every day. Um, and we want to be, I love this. We want to be present for our lives for those we love and serve. It allows us to be present. I think one of the things personally that I've noticed is that if I take time to decompress at the end of the day and I have a wind down routine at night, I don't wake up at 3 o'clock in the morning worried about everything on my to do list. If I don't do that and I choose to check my email until 10 o'clock at night because I don't know if you all know this, but if anybody in here has ever seen Harry Potter, howlers will come in your email and they'll be like, and they'll have, those are the emails you don't really want to open. And you get those at all hours of the night. So checking your email at 10 o'clock at night is not a good thing to support your well-being and decompression. And so really taking that time to decompress, having that wind down ritual makes a huge difference in how we're able to show up and take care of ourselves. I know I'm not telling you guys anything you didn't know, but I love this slide. This is also from the 3-day leadership retreat that I referenced that we do at ECU Health. And we talk about the fact that we're healthcare athletes. And, you know, when you think about my husband, well, it feels like the NBA plays constantly. So let's go with the NFL. So the NFL, they do not play a game every day, right? They play once a week and they recharge, right? They refuel their bodies, they train, and we're much like that, right? We're healthcare athletes. So it's like we go, we charge, we gotta we gotta recharge. Go again. Look, we get, and that's what happens is we come back stronger. When we take time to decompress, we really come back stronger. So sorry to pick on you, Ronnie, but you did tell us about the practice of five. One thing I want to ask you is, do you feel like you come back, you are more recharged as a human being now with that five practice than you were prior to putting that into place?
Absolutely. I do.
Yeah,
And I challenge everybody to do the same thing. And again, I'll be honest, absent from my five prime is obviously wife and kids. Those take a lot of your time. But if you choose to do whatever those five things are in your life every day, I promise you, I'm happy as I've ever been.
that's amazing. Why didn't you give this lecture, Ronnie? You should have just lectured on the five. That's incredible.
Because you're better at this.
No, no, I'm not. That's amazing. And then social well-being. We need each other, right? We need community. And so really thinking about how are you getting those connections that are really, really important to you? How are you getting connections with family and friends? This is one of the hardest things for me in my personal well-being journey is I love what I do so much I could work 24/7. Minus my kids. I'd come home, be with my husband, be with my kids, and I would never see my best friends. And that really is not living my best life. I'm a better version of myself with them in my life. But that requires a lot of intention for me because work never ends. So we said, as goes the leader, so goes the team, so goes the culture. So, what is one goal you're going to walk away with today? Troy, I feel like I heard one from you, but I'm going to let you set your own goal.
Now I
What's
need to focus on my health and energy for one thing, but I don't know if that's what you were thinking, but
That's what I was thinking. That's what I was thinking you said, at least. So, what does that look like? If you had to set a SMART goal, so
mhm.
specific, measurable, attainable, realistic, time sensitive, what would be let's all set one SMART goal. And if you don't want to speak up, at least put it in the chat.
Yeah, I know I failed at the beginning of the year at Christmas time frame where I paid for a membership to go to the gym, but that was the only day I ever went to that gym for like 6 months. But I'm looking to maybe start up something like that, and now that my health is kind of improved and I'm able to work out and do stuff, I think the first step is to try to get something like that set up so it'd motivate me to go and use the facility and improve my health and my energy.
So, what I hear you saying is you don't want to donate your money to a wellness
Right.
facility. You would
Right.
like to actually use the wellness facility and maybe start with once a week.
Yeah.
Yeah.
And
Who else?
I don't know where else in there, is addressing stresses though too. But I mean, our position, my job personally is starting to become pretty stressful. So somehow I have to address that. But I think health and energy would help too.
I think that's your emotional health too. I mean, when you think about stress, I mean, that's really your emotional health.
Yep.
Yeah. So finding ways. And the great news is the exercise is going to help you with that too. So that's good. What else? Couple more. Give me your goal. Okay, I've got one in the chat, I think. Ronnie, my time
I
left
can
on.
go.
Yeah, go. That'd be great.
I'm just like thinking ahead as I start to think for like jobs. So I'll be finishing fellowship this year,
Yeah.
and thinking about jobs is really important. This is my first real attending job, but I realize not all the jobs that I've been applying for are the same. So there's obviously a lot of variation in clinical responsibilities, leadership responsibilities, etc. So I told myself that the important thing at the end of the day is trying to recenter this around having more time for myself and having more time for my friends and family. And if that
Mhm.
means that I don't have like the best leadership role or the best pay, even, I think that's important to forego so that I can use the time that I not necessarily lost, but spent during training to kind of rebuild those connections.
That's amazing. And I think that's really important. So when you are interviewing, ask them about things we're going to getting ready to talk about. Like how are they supporting their physician's well-being? It needs to be a strategic senior leadership focus. Um, so I think that's great. Ronnie, thank you for putting that in. Claire says she's exercising daily and setting an evening wind down routine. Please share your blog. So Ronnie is sharing the 5. You have to share your blog so we can support you on your journey to becoming an author. That is incredible. Um, Ronnie wants to get into acting. That's amazing. Oh, Tim, that is so nice.
This is great. I love this.
That is so awesome. Okay, we're not going to ruin the surprise, but that makes me like smile so big I can't stand it. Um, And you know what? Got to do that. Been married 22 years. That's the only way I've stayed married, I think. All right. So, organization, creating a culture of well being. So, I just want to talk a little bit, and this is going to be what we're doing at ECU Health. And if any of you hear something on here and you're like, I want that wherever you're practicing, Monisha knows I would love nothing more than to get on a phone call with you all and tell you how we started and give you anything you need to get it started at your organization. So, um, you all saw the virtuous cycle. We're not going to go through that again. It's really built on cultural transformation theory and high reliability principles, which is our safety and quality partners. Um, This is cultural transformation theory. I really like utilizing this for teams to understand we really want to be in a partnership as a team, as healthcare workers. We do not want to be in this power over culture, this hierarchical culture. And you can see what that looks like. Hierarchy looks like I'm not going to greet you, I'm not going to really call you by name, and I'm going to like ask you how you are, and I don't even really take time to listen. And I'm going to give you the impression of I'm really irritated if you come to me because I know what's best anyway. Um, these a lot of times won't share with patients what's going on, and they don't really allow questions. They're like, I don't want your input because I know best. Versus when you're in a partnership with patients or with colleagues, you smile, you refer to people by your name. Some of these sound so elementary, but they don't always happen. You listen with empathy and intent to understand. You communicate positive intent. You narrate care. You practice mindfulness, which is really you're present, you're fully present with people. And you provide opportunities for questions. Just like you said, Ronnie, you're curious. Um, so I really, really like this concept that we've adopted at ECU Health. Happy to share this with you all. Something else that really has helped us from a cultural perspective, and this is not unique to ECU Health, is Code Lavender. So just like you said, Troy, I don't really know where stress fits in here or emotions, and that is how a lot of people feel. Most people aren't going to raise their hand and be like, you know what, I'm really stressed out, or my team is really experiencing a lot of stress. This framework has allowed us to open alongside talking about well-being other than saying mental health or emotional health or stress. We just say your overall well-being and include emotional well-being and mental health in that. People will raise their hand. They're like, I need a code lavender. And then one of my team from the Office of Wellbeing reaches out and says, "Hey, how can we support you?" And this is these are a suite of offerings that we can offer leaders or team members when they call and say, "We're just struggling." And sometimes it can be the death of a colleague, it can be the death of a patient, it can just mean, you know what? Just like we've been talking about administrative burdens, I just feel like I've just been hit left and right with just one thing after to do. Our team's just working, 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 and we go and support. I mean, it has been incredible to see how this has opened up channels for us to really talk about well-being and bring resources in. So it's really been great. Another thing that I would say, is, you said you're thinking about where are you going to go for your first attending job. Ask them about their onboarding experience. So one of the things we really felt was important and we hear and the literature shows is you really need to have a strong onboarding experience. And so we have one that focuses on finance experience, quality, well-being, and inclusion and belonging. And we really want our providers at ECU Health to know this is the culture that we are creating at ECU Health, and we're excited to invite you into our culture. And so it's just been great. I can't say enough. We have a physician and APP mentor program, and so we have trained physicians and APPs that will mentor incoming physician and APPs. We also have, and I didn't include it on these slides, a physician and APP peer support program, and as well as a physician new, we just started in the last few months, a physician and APP coaching program, which has been incredibly successful. So those are some of the things we're doing at ECU Health to create organizational well-being and really have just been super, super well received. And yeah. So now I'm free to answer questions. What are you curious about? Or what are additional thoughts do you all have?
I have a question. So, Christina, compared to where you started out with this and what you thought it would be, how do you think it's performed and done and evolved?
Yeah, I think, I had I don't really know what my expectations were, but it was really helpful for me to have gone to that. I referenced the Stanford course. Qualitatively, I would say, oh, it's palpable how it's helped the culture, but you got to quantify it, right? And so what I can tell you is that our utilization of our employee assistance program, which is really who is our biggest vehicle for supporting well-being, has gone up exponentially over the last 3 years. And what we've done is we've evolved our employee assistance program to really be organizational support as well. So it's not just individual counseling. They go out and support teams, they support leaders, they do well-being pop-ups. I mean, I could talk to you all for like 4 hours. So that's been amazing. So we've seen utilization of our resources. The other thing that we've seen that I'm probably truthfully makes my heart the happiest is on our engagement survey, we have increased our resilience index on both activation and decompression just incredibly over the last 2 years. And I'm most happy about the fact that what we've increased the most is our decompression. Because when I started this job, what people said was, I cannot shut it off. I can never be off. My physicians, my nurses, God, my nurse managers were like, I get called all hours of the night. I'm on the baseball field. Like they couldn't shut it off. And now our partners that do our engagement survey were like, what are y'all doing for decompression? This is unheard of to see how much better you're scoring in this. So I just think that's amazing. And I don't attribute that. What I really attribute it to is there has to be a focus on well-being at the senior level, that it is part of our strategic focus. And we've had that. So our CEO has been really, really supportive. And so I think that's been wonderful. Did I envision it, to answer your question? No. And this job is nothing. If you told me 2 years ago you were going to be doing this and this and this and this would report to you, I'd be like, what? And I love it. I mean, I wake up every day, my feet hit the floor, and I feel blessed to do the job that I do. So I call that a win. What else? Any parting
I think you
thoughts?
have wowed them so much. They're just kind
I don't
of
know
just
about that.
overly impressed. Dr. Bowen has done an amazing job of weaving together so many different things, the individual ideas related to well-being. I think all of us were taking notes on some of the things that Dr. Bowen and Ronnie mentioned about what can you do to decompress and to be in a better state of well-being. All of the leadership and organizational approaches that she shared. Again, all of you work in very different places and in very different environments, but hopefully you took to heart some of the things that she was talking about across an organization and how to improve culture. And I love the quote about, where the leader goes, so goes the culture and the rest of the organization. Those things are really important. I do want to go ahead and take another opportunity for any final comments. Claire, you came on camera. I didn't know if you had to,
Yeah, I'm a chief medical officer. I'm close to you. I'm in Kinston at UNC Lenore.
Oh, that's amazing.
Yeah. So, what advice? I've tried to work hard with my medical staff to create a great culture, but
Yeah.
how do you? And we've done better on our physician surveys every year.
Yeah.
And I got we have a new orthopedic surgeon, and he's making the OR work. So of course they're just trying to write him up. He's a new guy. They're trying to exert their dominance, a little bit. And they completely, it was a dirty write-up, and so I was able to stick up for him and say, well, you guys should have followed your policy instead of, phrasing it like you're accusing him of something, right?
Yeah.
And I mean, actually accused him of not seeing the patient when they just had questions about the informed consent, and he came down to the OR. He goes, "There's my initials.
Yeah.
I saw the patient." That kind of stuff. And I got the nicest text message saying, "I've never seen a physician leader. I've never had a CMO who stood up for things like this."
Supported him.
Thank
Yeah.
you. So it was heartwarming to me to get something like that. But how do you move on to putting in, because we don't have a wellness, like a real great structured physician wellness. I mean, how would you go about just starting to layer in some things to your medical staff or to your meetings or
Yeah.
anything? Where do you start?
Well, so first of all, I want to say that was incredible what you did with that orthopedic surgeon. And I'll tell you, it's interesting. I've had a similar case. They attacked his sense of purpose. You did not see the patient. And rather than say just exactly what you said, and that like cuts to the core of some of our gruffest, toughest physicians. So I love that you said that. And I think, if you don't have a structured wellness program, what I would say, first of all, Nadia is amazing at UNC. I know she's in Chapel Hill, but she is an incredible resource to you if you haven't met her. And I would butcher her last name
Last,
if I
um,
tried to pronounce it. Manisha?
Charguia.
Yeah, Charqui.
And I
See,
am actually writing a message for you now, Claire, in the chat.
okay. Yeah, because
oh, okay.
she's incredible and she's a wonderful resource. And the other thing I would say is the NCCPRW has partnered with the Lorna Breen Foundation. And so phase one was to get the credentialing changed for our physicians and APPs, which UNC has already done and has taken out stigmatizing language. And then the second phase of it is there's an entire platform that's around well-being and basically a playbook that they give you to start well-being programs in your organization. And so I would start there. It is an amazing platform, Claire. And it doesn't take a lot of time. I don't know, Manisha, is it like 5 hours or something to go through it?
3.
Oh, only 3.
Manisha, do you have a link or that resource?
I am getting ready to share it now. Perfect.
Yeah. I mean, that's what I would say. And Claire, honestly, I feel like, did you get Doug Schiller? Is he working for you now? Do you
We
know
have
Doug?
Doug, yes.
He's
You
one of
can't
my
have him
favorite.
back either.
I love him. Oh no, I'm so happy for him. He has got a great work schedule. You have to tell him that we were on a call and say, Dr. Bowen said, "Do you want a cheeseburger?" He will die laughing.
I'll do that tomorrow. I'll go by the
Yes.
ICU tomorrow and ask him if he wants a cheeseburger.
I adore him. So I've heard really great things about you. And I was just going to say, I mean, honestly, I'm putting my email and my cell in the chat. I'm in Greenville all the time. I would love to get together and I can
Okay.
share more about programs and stuff that we have.
Perfect. That was an excellent connection. Thank you so much, Claire, for asking the question. And so more to come about NCCPRW. We are preparing right now to have an in-person meeting on October 24th. And UNC Health is one of the 25 facilities that have signed on to participate in this next round of all-in caring for North Carolina's caregivers. So we are trying to reach across. First Health is already signed on in Dr. Stanzione's area. So we are working across our state. Wonderful. Thank you. I'm going to go ahead and take up 2 minutes, not even quite 2 minutes of your time, just to share a summary real quick. And I want to thank Dr. Bowen before we go anywhere any further with a round of applause. It was just wonderful. I am so appreciative to you. And like I said, everything that you shared in terms of leadership, organizational approaches, and individual approach. And then NCCPRW is trying to work on a systemic approach as well. So please complete your evaluation. A big thank you to Erica for placing the link in the chat. I'm going to run through these next steps really quickly. The first one is a little gray because hopefully you all did that already. By August 12th, you were supposed to have a virtual PDP check-in with your assigned group of scholars. Friday, August 8th, that was the deadline to send your project title updates to Erica. And I will tell you, we are getting ready to send out those graduation invitations. So if your title is not as tight and neat and pretty and sounding as good as Dr. McColl's, then you have a problem. So please work on that title and get it sent to Erica ASAP. Send your graduation guest list with names and emails to Erica because, again, we want to go ahead and get out the graduation invitations. And Dr. Bowen, that would give you an opportunity to hear the great projects that these individuals are working on at their individual organizations. And then Monday, September 1st, you submit your final PDP. Based upon our last in-person session, it seems like you are really making a lot of progress on your PDPs, so please submit those to us. And then our final graduation session and in-person learning will take place on Saturday, September 27th. We will be joined by Jonathan Behar. You may remember Jonathan. He was the one who came and talked to us about VUCA, how to lead in these VUCA times. And so he's going to be back with a follow-up, and we'll have our graduation and we'll have our final presentations. So we're excited about all of that. I will give final comments to Erica first, then we'll go to Dr. Bowen, and then to Dr. Kolmaves in that order. Erica?
Good evening, everyone. Just want to reiterate, if your titles are not what you want them to be, please, please, please send those to me via email at your earliest convenience, as Monisha said, and that way we'll have this information to share out with your guests and all the other guests that we're sending with the NCMS membership, and that they'll be able to log in at the appropriate time. And then the only other final thing, oh, nope, looks like Dr. Bowen logged off, so never mind.
That's okay.
But yep, don't forget to do your evaluations, and I'll drop the link in the chat and we'll send it via email as well.
And Dr. Kolmaves?
Sorry, had to get myself off mute. Yeah, I just want to say thank you to everybody for spending your evening with us. This was awesome. And hopefully you guys got as much out of it as I did listening in. So.
Perfect. Thank you all again for spending your time with us. And if you need anything or need any additional information about NCCPRW, please let us know, because that comes straight to you from the North Carolina Medical Society Foundation. And there's a wonderful executive director for that program. Her name is Manisha Thomas. If you haven't met her, she is wonderful. Thank you all again for spending your time with us. We appreciate it. And we will be talking to you via email, and we will be waiting to get those great project titles, because they go on the invitations that are going to go out electronically. So please make sure you share those with us. All righty. Thank you all. Have a wonderful evening.
Yep. Thanks.
Bye.
Take care.
Enjoy, Tim.